Reading Part A test has a total of 4 texts. What are these texts based on? Again, they are workplace related texts. So these all 4 texts will be based on one single healthcare topic. So imagine that, for example, you are working in a burn unit, okay, and this is your first day in the burn unit as a doctor or as a nurse. So you know the basics about burns. Definitely you may have some past experience as well, but depending on that particular hospital or depending on that particular department, how the burns cases are dealt with, for that you are likely to have this kind of protocol. Yeah. So you can see here the text A. This is how you will have the short text in reading part A text. Let me show you here. So you can see here text A. They are all on burn injuries. So you have text A on dressing minor burns. Then you have text B on assessment. Then you have text C on analgesia. And you have text D on immediate management for major burns. So these are the kind of texts that you will have. Again, this text will be kind of very short notes. Yeah, because again, this is something you are going to use when you are in the workplace. So this is not something which is like textbook. It is not something that you would read to find out latest research on it. No, these are not the academic texts. They are just a very quick guidelines as to how you would deal with such a situation. And along with this 4 short text, you have 20 questions. Okay? So you have a total of 4 workplace related texts and 20 questions. What are the texts about? Okay, they will all be on related to one healthcare topic or a single healthcare topic. So although they are 4, they will all be related to one single topic. Now, what are the skills being tested? Okay, so if we have 20 questions, what kind of questions do we have? So you have a total of 3 types of questions when it comes to reading part A. You can see here on the other side of the screen, you have questions. Okay, so here we saw the text, and on the other side here, you have the questions. So first set of question will always be matching question, which means they would give you a question which would basically be a piece of information from one of these 4 texts. Okay, so you have to find out from which text the information comes from. In which text can you find the information about, for example, the administration of oxygen? Say, for example, if this is in text D, so you write text D as an answer here. So you don't have to answer these questions, you just have to match it with A, B, C, or D. So these are the matching questions. Okay? So the first set of questions that you would have in reading part A will always be matching. So that will be 1, 2, it could be 6 or 7 questions that will always be matching questions. Now, what is being tested here? For example, yesterday when we did main idea questions, I said it is testing your ability to understand the main point, to understand the summary. So here part A text, what are they testing? They are testing your ability of skimming. Okay. What is skimming? Skimming means reading the text very quickly to get an overview. What do I read? Do I read every single word? No. So what do I read? Instead of reading each sentence, what we do is we read headings, subheadings, okay? And there are different skills that we need to use for skimming different types of texts, so that we are going to learn today. You can have paragraphs, you can have bullet points, you can have tables. So we are going to learn today how do we skim the different portion of the text. So here you can see the text A, right? Here you have text A, and what we are learning now is the skimming technique. So what do I do for question number 1 to 7 is I don't read the question first, I read the text first. So first I read the text and then I go to the question. This is a major difference, students, for the skimming. Okay, in skimming skill, you wouldn't read the question first, you would read the text first. So if you look at the text here, we would not read every single word, we would just pay attention to headings, subheadings, and layout. So you can see here, heading says dressing minor burns for adult and child. That means this entire paragraph contains information about dressing. Now you can see that there are some bullet points here, right? So how do I skim the text with a bullet point is that I just read first 3 words of each bullet point, just first 3 words. So here it says addressing functions. So here this bullet point tells me what is the function of the dressing. Then here it says if the patient is for transfer, what kind of dressing I should use. For superficial or mild wound, what kind of dressing I should use. And then you can see that these 4 are main bullet points and these 4 are sub bullet points. Yeah. So here it says for superficial you should use certain kind of dressing, and then again you have a few different kind of dressings here. See, I'm not reading the whole sentence, just first 3 words of each line, and I particularly pay attention whether all these bullet points are at similar level. If they are all at similar level means they all talk about different issue. But if there are sub bullet points, that means this all bullet points are related to this issue. So now I have understood that this entire text gives information about different types of dressing. It tells me what is the function of the dressing. It tells me what kind of dressing should I use if it is immediate transfer, what kind of dressing I should use for mid-deep dermal wounds, and then some dressing types are given here. And finally, last point tells me that I should switch to simple paraffin based. Okay, switch to. So switch to itself means that later on, maybe initially I would be using some other dressing, but later on I would be switching to. Switch to means change to. So now I have understood this text. This process, guys, is known as skimming. When I don't read every sentence very slowly, but I read very fast. And if they are bullet points, I just read first 2, 3 words of each bullet point. And then what I do is I go to the questions and I find out which question, which sentence from this is matching with text A. So now find out which question matches with text A. Send your answers privately so that other students don't get to know about your answer choices. which out of 1 to 7, which sentence matches with text A? Okay, so some of you have said 3. 3 is not the correct answer because it says how long it takes for burns to heal. How long means it should be talking about duration. Here we do not have any duration. So 3 is not A. 5. Almost everyone has written 5. Yeah, so that is correct. 5 is A because it says recommended options. So 5 is A for sure. Then some of you have written 6, identifying the severity. Now identifying is assessing. Assessing. I do have severity here, superficial, mid, deep, dermal, but does it tell me how do I identify? Does it give me any signs and symptoms of burns? No. It is focusing on the treatment. This particular text, text A, is focusing on the treatment of burns. So 6 is not A because it doesn't tell me what are the signs of superficial burn, what are the signs of mid-deep dermal burn. 7, yeah, choosing the most appropriate cover for second degree burn. So here it is given, no? Second degree burn. What kind of dressing should I use? Perfect. So 5 and 7, they both are A. Now see, what is the benefit of going with this approach is that while answering 1 to 7, I get to know the whole text really well without having to read the whole text. I haven't read every single word. Still, I know probably what information would be covered here. Yeah? And you will have to logically think if the heading says dressing minor burns, that means this entire text talks about the treatment. So if it talks about the treatment, it cannot be identifying. Identifying means it is the assessment step. Yeah, it cannot again have healing point in that because it is about just the treatment, not even healing. Now we will learn how to skim a table. So tables are comparatively easy to find the information, but you should know the correct way of skimming the table because tables can be quite dense. It could have lot of information. So how do I skim the table is again, I don't read everything. Okay, let us write the skills for table here. We have written the skill for how to skim the bullet points. Yeah. So let us write this clearly. What are the skills that we need for skimming? Okay. So how do I skim? First of all, I pay attention to headings and subheadings. Then I pay attention to the layout. Sometimes layout can be very, very helpful. As I told you, if there are bullet points which are all in the same, at the same level, that means they all are related to one topic. But if the level changes, that means those are sub bullet points. Okay. So third skill is if there are bullet points, read first 3 words of just first 3 word, okay, of each bullet point. You don't read the whole sentence, you just read first 3 words of each bullet point. Then if it is a table, okay, if the text is a table, then what you do, you read or you can underline or encircle headings of each column and each row. Just this, okay? Each column and each row, you wouldn't read them in detail. No, you don't need to read them in detail. You would just read the heading of each column and the heading of each row. So let us read it here. It says burn assessment. That means this is the kind of text which I would read when I have to determine what kind of burn is it. So how do I determine the depth, pathology, color, circulation, sensation, blisters, and healing time? Right? So see, reading the heading itself tells me what all information is given here. It gives information about what kind of blisters will be there, what would be the depth, what would be the color of the wound, what would be the situation of circulation, would there be any sensation or not. And it also gives me information about how much healing time would be required for these four types of burns: epidermal, superficial mid-dermal, okay, then mid-deep dermal, and full thickness. That's all. My skimming is done. Okay, I wouldn't read everything. I would just read this much. This is skimming. Now, what I would do is I would go to the this is skimming. I only need to read this much. Now go to the question 1 to 7 again and see which one is matching with text B. Yes, for 5 we have already written A. For 7 also we have written A. Now find out which of the other options are matching with text B. Yeah, so 3 is B because it gives information about healing time. So that is B. And 6. Yes, now do you all understand why 6 is B? Because it says identifying severity. How do I identify severity? With the help of color, type of blisters, circulation, yes, and pathology. What has caused it? So 3 and 6, they both are B. Very good. Okay. Now text number C. So we read one text at a time so that and when you are skimming the text, also try to remember which text had what kind of information. This will be helpful to you later on. Yeah. Now see, again here you have a table. Again it seems to be dense. But what does it look like? Have you seen something similar in your workplace? What is it looking like? What is it? Have you seen something similar to this in your workplace? This kind of document have you seen in your workplace? What is it? It is like the drug book, yeah, where you have the details of medication, what information to be provided, what kind of precautions are to be taken, whether it can be used in pregnancy or not, and how to manage side effects. Yeah? So again, you don't read everything that is given here. You just read heading. So you have information about morphine. It gives you information about form of morphine, strength, route, dosage, duration, how to, what information should be given to the patient, where should you use less amount of it, whether it should be used in pregnancy or not, and how to manage the complications. So now match it with 1 to 7. Which one is matching with C? Yeah. So 2 is C because it says side effects. Yeah, and you have management of emergency. So 2 is C. Do we have any other option that matches with it? IV cannula insertion, but we don't have any information about cannula insertion as such. Nothing about cannula insertion. There's nothing, no advice as such. This is not for advice, isn't it? You have the word advice, but it is not about how to insert or when to insert the cannula. So just 2 is C. And now you have management, fourth text, text D. So recommended immediate management for major burns. So see, there will be some overlapping of the text. Text A also talked about burns management, but it only talked about minor burns and dressing. Whereas here it is major burns. Again, they are all bullet points in the same range. That means they are all about immediate management. Again, we read first three words. Remove, about clothing, one more point on clothing, survey, okay, cool, non-infected, give oxygen, what to do if cervical spine is affected, what kind of wrap should be used, what to do with limbs, yeah, consult medical officer, and insert IV cannula. So we read first two, three words of each bullet point, and that's enough for skimming. So now can we match this text with 1 to 7? Which questions are matching with text D? Yeah, 1, definitely 1 because it says administration of oxygen. Yeah, this is why skimming is very, very important. Skimming doesn't mean just reading heading and subheading. No. Okay. There's a particular technique, and you need a separate technique for each kind of text that you are dealing with. If there are bullet points, you read first two, three words. If there are tables, you read heading of each column and each row. If it is, paragraph, then you read first and last line of each paragraph. So you need a different set of strategy for skimming each kind of text. Okay, now, so we have listed down the skimming techniques here. You would need these techniques for question number 1 to 7. Yeah. Now we are going to learn scanning. So the skills that you need for reading text A are two skills, skimming and scanning. So now let us understand what is scanning. Okay. So now what is scanning is when you are reading the text to find out a particular word. If you have ever used this function in Word file, if you are writing a Word file and if you want to search a particular word, if you go to the search column and if you type in that word there, what the Word file would do is it would highlight that word wherever it is with yellow color. So every time, wherever that word is used, everywhere it would get highlighted. So that process is known as scanning. You read through the text very quickly to locate a particular piece of information. See, the purpose is different. When you were skimming, You had no purpose. You were not trying to find out one thing. That is why we didn't read the question first in skimming, because we were not trying to find out one particular thing. We were just trying to get an overview of the text, what the text is all about. Whereas in scanning, we read the question first. We read the question first, we find out. Okay, so scanning means reading the text again very quickly. Entire part A of OET is expeditious reading, which means you have to read as fast as you can. So reading the text very fast to locate a particular so you should have a particular word in your mind that you are looking for when you are scanning. So how do I find out? Okay, the first skill that I would need for scanning is that I would have to find out what am I looking for, because I will be reading the text to find out one word or one sentence. So now let us learn with the help of this text. How do we find out that? Okay. Now for a moment, we will keep this text aside because we are right now focusing on scanning. Okay. So the second set of question that you will have in the reading part A question could be either question, short answer question, or it could be gap fill. Okay, fill in the blanks. So here we have some short answer questions. Now what I do is for scanning, the first thing I will have to do is I'll have to find out two key words, okay, from the question. Two keywords from the question. So it would be basically one keyword, and one would be, second would be type of word that I have to find from the text. So two keywords we have to locate from each question. I'll show that to you for first two questions, and then I would ask all of you to find that out for next 5 questions. Okay, so let us start this activity. So first question says, what type of scarring may result from a mid-deep dermal burn? So this mid-deep dermal burn is my keyword. I will have to find out this word in the text or its synonym, because see, this is a language test. So I may not have the exact word as it is. And another keyword is, what am I looking for? What kind of information I'm looking for is type of scarring. So scarring, yes, we know scare, happens when the burn heals. During the healing time, you have the scar. So now we would be able to find out, at least we would be able to decide which text can have this answer. Types of burns we have in text B, and we also know that the healing process is also given in text B. Probably you can also recall which column gave you the healing portion, right? It was the last column on right hand side that gave us information about scarring and mid-deep dermal burn. So what I would do is I would go to the raw, find out mid-deep dermal burn, and then I would find out, match it with the column healing. Okay, let me show that to you so that you would be able to understand. See here. Yes, we knew that here you have types of burns. So I have to find out mid-deep dermal burn. Here I have mid-deep dermal burn, and then I match it with healing, because I also have blisters here, but it says scarring. It doesn't say type of blister or wound. It says scarring. So here I can find out hypertrophic scarring. Yes, again, I'm not reading everything. See, I'm just matching this with this hypertrophic scarring. So my answer for this question will be here hypertrophic scarring. Even if I just write hypertrophic, that would be adequate because it is just asking what type of scarring. So now I want you to do the same process for question 9. Yeah, give it a try. I would also be doing, but slightly little later. Before that, I want you to do that. You have to find out one keyword and what type of information do we have to find out. One keyword. So morphine is the keyword. Yes. And what type of information am I looking for? Dose. But it is maximum dose. Yeah, and it doesn't tell me anything about which age group, which situation. It doesn't tell me anything about that. And which text can I find this information in? Text C. Yes, because text C gives information about morphine. So now do that for 10, 11, 12, 13 and 14. These 5 questions. You have to do 3 things. First, you have to find out what is the keyword. Second, you have to find out what kind of information you are looking for and which text can have this answer. Go ahead. Very good, Kathan. Go ahead. All of you try and participate. It will give me an idea whether you have understood the concept or not. Yeah, so here I'm looking for type of dressing. Yes, and I can have this answer in text A because text A tells me about immediate transfer. We have read this word already in text A, right? We know that immediate transfer word is in text A. Otherwise, immediate management is given in text D, but the word transfer is given in text A. Good, very good. I can see only 1 or 2 students participating. Please participate. Yeah, so here you have keyword epidermal or full thickness bone. What may be absent? So what type of information I'm looking for? Something that is absent, not present. Again, where can I have this answer? Text B, because text B gives me information about types of bones. So here, what is my keyword for question number 12 is what type of dressing is used once the wound has become pink with no eschar. Once the wound has become pink. So healing is given otherwise in text B, but question is asking type of dressing. So what kind of information am I looking for here is type of dressing. And my keyword is pink with no eschar. Then what may result if an alternative sorry, here there is a problem with the question. It is not an alternative, it should be antagonist. Okay, not alternative, antagonist. Antagonist means if you give any medication and if you think that this medication has been given as an overdose, so you give another medication to counter its effect, and that is known as antagonist. Yeah, antagonist. So here, what is my keyword? Antagonist to morphine is my keyword. Okay. And what type of information am I looking for? I'm looking for side effect, or I'm looking for consequence. What type of word should I find out? Consequence, because it is already given that antagonist is given. It is not asking what kind of antagonist, it is asking what may result. What may result? So I'm looking for a result or a consequence. Consequence of what? If antagonist to morphine or opioid is given. So where can I find this answer? In text C. Because text C gives me information about morphine. Very good. Water be used to cool that yeah. So that is not the keyword. With the water, I would not be able to find out the answer. My keyword is serious burn. The whole phrase. Okay. What should be done to cool a serious burn? And how long? How long should running water be used? So how long? That means I'm looking for duration. How long means duration. If someone tells you how long have you been staying in Ahmedabad, they're asking for duration. How long have you been working in this institute? Okay, so how long? So this is what you would have to do. Okay, here also it says serious burn. So serious burn is discussed in text D. So I would find this answer in text D. This answer I would find in text C. Okay, so now let us look at the text. Okay, and find out this answer. See, I have given everything to all of you. Okay, we have answered question 8 already. Now what I would do is I would first get text A here. So you will find out the answers for the questions which are given in text A. Then I would get text B for you, then text C, and then text D. But when you do it in the exam, what you should do is you should answer one question, then move on to the next. Okay? Why we are doing this here is because when we do it online, there are certain limitations. You don't have text with you at the moment. That is why. In exam, what you should do is after answering question 8, you should find out the answer for 8, write it, then move on to 9, then move on to 10. Here, because we have certain limitations, we are following this method. Okay? So now I'm getting the text for you. Um, at least all of you write this, which text has what answer. Write this, because once I go to the text, all these things will be deleted. Very quickly write on a piece of paper, particularly those who are doing this for the first time. Write which text would have these answers and what kind of word you are looking for. Okay? At least write the text numbers for each question. Now I'm going to get the text for you. Okay, so now find out the answer for from text A. There were two questions where we said the answer will be from text A. Now it is okay if you don't type in your answers. That's fine. You can write it for yourself on a piece of paper. That's fine. Write it for yourself. Don't type in. So what may be applied and immediate transfer was our keyword. So here we can see the word immediate transfer. Okay. It says apply silver sulfadiazine and melanin. So this is my answer for question number 10. Silver sulfadiazine and melanin. And here it says what type of dressing is used when the wound has become pink. So we assessed here switch to. So it says simple paraffin based dressing. So answer for this question 12. Yeah, we had decided that it has to be a type of dressing. So that is simple paraffin based dressing. This is the answer for question number 12.
Ma'am, what we write only paraffin?
No, that's wrong. Simple paraffin based dressing.
Okay.
Okay. Now text B, right? Find out the answers from text B. So 8 we have already answered. 11th can be found from text B. Absent, okay, and full thickness burns. So I will read full thickness burns and I would see what may be absent. So here two things are given, but question is asking what may be absent in epidermal or full thickness. So I have to now check both epidermal and full thickness. So here it says nil, but here it says normal or increased. Here it says nil, but here it says present. So what is there which is absent in both of them? So in blisters, it says none, and here also it says no blistering. So what may be absent in both the types of burns, epidermal and full thickness, is blisters. Yeah. Now text C. So we can find ninth from text C. We find 13th from text C. And read antagonist, okay? Not alternative, but antagonist. So what may be given, what may result in? So we were looking for side effects, so it has to be somewhere here. Now my keyword is antagonist, antagonist, so I can find it here. Naloxone is antagonist, but again question is asking what may result. So naloxone is antagonist, but what may result? Okay, so here they have mentioned that naloxone has a shorter half-life and therefore may require repeat dose if recurrence of the sedation or respiratory depression. As naloxone counteracts the opioid, it may cause the return of pain. What may result in? Return of pain. That's my answer. What it may cause? Return of pain. Could you all get this answer? And this is easy. Maximum overall dose of morphine is recommended. So here you can see the maximum dose 10 mg. If you have written 0 to 1 mg, 0.2 mg per kg is wrong because question is asking maximum dose. So maximum dose is 10 mg. Overall, again, it is not asking maximum dose per kg, it is asking overall dose. So 10 mg is the answer, right? And now for text D. So how long this question? 14th is from text D. Yeah, 20 minutes. Yeah, running water. So how long? Even here, immediately cool burnt area. Why? For 20 minutes under cool running water. So that is 20 minutes. How long? I was looking for duration. How long? That is 20 minutes. Okay. Now from 15th to 20th, I'm not going to help you with anything. I would just keep text here. You have to find out what the keywords are. You have to find out what kind of information you need, and you have to find out the answer from the text. Okay. So I will keep each text for 1.5 minutes or maybe 2 minutes. Okay. And you have to answer these 6 questions. Now let us start looking at the answers. Yeah. So 15th says, a repeat dose of naloxone may be given for rare events of rare. So you have two side effects here. One says you may need to give repeat dose if there is sedation or respiratory depression. But question is asking rare. So you need respiratory depression. If you have written sedation, it is wrong. If you have written sedation and respiratory depression, it is wrong. You just need respiratory depression because it says rare events of. So sedation is not rare, respiratory depression is rare. Then the patient with a significant renal disease, a blank dose of. So here you can see that a reduced dose should be considered in patient with renal and liver disease. Okay? So if you write lower end of dose, it is wrong because it is for patients above 70 years. Reduced dose or reduced, you just need to write a reduced or reduced because dose of is already given. So if you write a reduced dose, that is also wrong. You should not repeat something which is already there. A reduced. Then if the clothing is smoldering, large volumes of blank. So here we had some information about clothing. Yeah. So it says that if it is smoldering, if it is sticking, large volumes of cool water. Cool water. That's your answer for 18th. Then the use of blank as a dressing is recommended for severe burns in the first instance. So here we were supposed to find out severe burns and what is used as a dressing. So here they've mentioned use cling wrap for initial dressing. Cling wrap. So cling wrap is the answer for 20. Now let us find out 19th and 17th. Red appearance, okay, and warm to touch. So appearance is given here, color, and warm to touch. So that is epidermal burn. Red and warm to touch. Result of an epidermal burn. That is answer for 17. And for 19th, I was looking for a type of dressing that is an alternative to Mapilex, but less absorbent. So Mapilex is given here. Here they have said Alvin has similar property. It is less conforming and absorbent. So Alvin is the answer for 19. Alvin. Yeah? So this is how you deal with. See, even when we have answered all 20 questions correctly, still I have not read so much, a large portion of the text, right? So this is the main difference between text A or part A of the reading test and part C of the reading text. In C, you read everything, you analyze because it tests your critical thinking skills. It is not just finding answer in the text. Yesterday I was explaining you how text C you are not matching. Yeah. But here we literally matched. We literally found the answer from the text. We were matching it. Whereas part C is not about matching. And speed is the key because this is expeditious reading. So speed is the key. Spellings should be correct because you are basically copying and pasting the answer. You don't have to change it in any way. So it's important that your spellings are correct. Make sure that you are carefully copying the answers. So your spelling should be correct.